Mr. President.
The Senator from Massachusetts.
Thank you, Mr. President. Mr. President, I stand here in strong opposition to the nomination of Robert F. Kennedy Jr. to serve as the Secretary of Health and Human Resources for the United States of America. The American people know that our health care system is broken. Families have to work through too much health insurance red tape only to be denied care or forced to pay out of pocket. Medical debt is the leading cause of bankruptcy in the United States. Families are saddled with medical debt from prices that are too high and burdened by quality of care that is too low. When they need to get an appointment, they have to wait months, drive hours, or simply go without the care which they need. Pharmacies, hospitals, community health centers struggle to keep their doors open, and communities are watching health providers and workers burn out under the strain of a healthcare system that is increasingly being sold out to greedy investors and the billionaire class. The American people deserve a real healthcare system, not the current sick care system. And they deserve leadership, which will recognize all of these problems and commit to solving them. Instead, Donald Trump and Elon Musk are only making things worse. To Elon Musk, move fast and break things is not in the United States Constitution. That's why these federal district court judges are stopping your actions. In Trump's first 3 weeks in office, he has taken illegal and unconstitutional action that disrupted life-saving health research, sent Musk and his Doge acolytes to make cuts in Medicare and Medicaid, cut off federal funding for community health centers, used discriminatory fear-mongering to threaten federal funding for hospitals and health providers just trying to provide care for their patients. Every chaotic decision, every cut, every illegal action are all to make it easier for this administration to work alongside congressional Republicans to slash and burn our core health care programs. They're not doing this to make things better for everyday Americans. It's Robin Hood in reverse. They are working to take from those who need it the most just to give billions more in handouts for defense contractors and their billionaire donors. They want hundreds of billions of dollars in tax breaks for billionaires. They want to increase defense spending by $150 billion, more nuclear weapons, more. But then it turns and says, where are we going to get the money? And they say, oh, we're going to Medicaid. We're going to the Affordable Care Act. We're going to community health centers. We're going to go to the programs that actually do protect people. More nuclear weapons aren't going to protect people. It's having access to the health care system that can help protect their families. Now, Trump and Musk and Republicans, they're going to call it efficiency, or they'll call it transparency, or they'll say it's just adding basic requirements to Medicaid. This is all code, the code for cuts. Efficiency, transparency, or just be honest about it, Elon. Just be honest about it, President Trump. Cuts to programs. They keep saying there's all kinds of waste in the system. Well, point it out to us. We'll cut it out for you. Give us the list of the programs you want to have cut because they're waste, and we'll do it. But you want to know what they don't want to say? They don't want to say that they want to cut Medicaid. They don't want to say they want to cut clean air, clean water, the programs to protect ordinary people. They want to call it waste, and we're going to call it out for what it is, where they're going. They're going to the programs that help provide the health care for ordinary Americans. Cuts to health care that Americans rely upon. And when Americans have to wait longer for care, when they have to pay more, watch the only hospital in their community shut down, the blame for what will happen will lay at the feet of the politicians who put self-interest above the interest of the American people. And rather than consider a nominee who would seriously protect and preserve the health of the American people, Donald Trump nominated yet another enabler to his cabinet, Robert F. Kennedy Jr., who instead of standing up to the Trump-Musk chaos, will only add fuel to Donald Trump's Make America Sick Again campaign. Because that's what it is. Make America sick again. Ralph Waldo Emerson from Massachusetts, he said, health is the first wealth. Well, that first wealth is going to get looted, so billionaires get even richer. And serving as Secretary of the Department of Health and Human Services is an immense responsibility. The agency oversees the Centers for Disease Control and Prevention, the Food and Drug Administration, the National Institutes of Health, which is made up of 27 institutes and centers, and each decision that an HHS Secretary makes will have a huge impact on our healthcare system. Run well, HHS ensures medications are safe and effective, keeps workers and students and seniors safe, protects the public from global pandemics or disease outbreaks, guarantees hospitals, doctors, and community health centers provide safe, quality care, and funds research that will build the foundation to accurately diagnose patients, better treat cancer, cure Alzheimer's, heart disease, diabetes, cancer. That's what it's supposed to be all about. Not freezing that funding, not cutting that funding, but ensuring that the researchers have the funding they need. Because research is medicine's field of dreams from which we harvest the findings that gives hope to families that we will find the cures for those diseases that have run through their family's medical history. And we know that HHS has Health and Human Services, but it also stands for Human Health Security. And the stakes of leadership are life and death. But instead of nominating a serious and qualified candidate, Trump selected a candidate who questioned the well-proven conclusion that HIV causes AIDS, made millions by spreading lies about vaccines, compared vaccine mandates to Nazi Germany, said Wi-Fi and cell phones cause leaky brains, threatened to remove fluoride from drinking water, and made baseless claims about medication for depression that it would lead to mass shootings. Well, Mr. Kennedy's track record shows that he is a danger to the health of America. He would make America sick again. In June of 2019, he went to Samoa on a trip arranged by anti-vaccine activists. He used that trip to spread lies about the measles vaccine in the Samoan Prime Minister and Director General of Health. He and the organization he led amplified activists who spread false information about the measles vaccine. And after a measles outbreak broke out in Samoa and 16 people died, rather than intervene and help, Mr. Kennedy sent a letter to the Prime Minister to blame these deaths on the vaccine rather than the absence of vaccines. The death count in Samoa grew to 83. Volunteers in New Zealand sent tiny coffins to help bury the dozens of children who died. A New Zealand vaccinologist later said, the impact of Mr. Kennedy's role in the outbreak was devastating. In a moment, when Robert F. Kennedy Jr. could have used his influence for good, he fueled disinformation that cost lives. When Robert F. Kennedy Jr. was asked about Medicare and Medicaid, he could not answer questions in his confirmation hearing about the most basic questions, demonstrating that he would be at HHS only to make whatever cuts that Trump and Musk and Doge dictate at the expense of the health care of the American people. Now he's in line to be the #1 healthcare official in the United States. That would be a disaster. Mr. Kennedy has reportedly given reassurances on his position on vaccines or on his position on food and chronic disease. To my colleagues, I would say this. We cannot address chronic disease if we are slashing Medicare and Medicaid and the Affordable Care Act or recklessly cutting off funding from hospitals and community health centers. If we are battling vaccine misinformation, it will make it much more difficult to take on chronic disease like heart disease or diabetes. The long-term impact of food on children's health doesn't matter if children are dying from preventable infectious diseases because their families believe misinformation spread by the nominee for Secretary of Health and Human Services. And even with the promises he has made on the vaccine misinformation, Robert F. Kennedy Jr. has not demonstrated that he will fulfill his promises. He has used his position to lead people down the dangerous path of vaccine misinformation, and when asked about his role in the Samoa measles outbreak, he lied. The stakes are too high to take a risk on this nominee. I hear from people in Massachusetts who rely on our health care system, single mothers of disabled children relying on Medicaid, also called Mass Health in Massachusetts, to make sure their child gets care. I hear from people living with cystic fibrosis, or parents of children on the autism spectrum or with Down syndrome who could only afford their medication or coverage with Mass Health Medicaid coverage. For them, Medicaid is the lifeline. And when that lifeline is cut, their lives get harder. And that's what this administration is aiming to do with Robert F. Kennedy Jr. in the lead. The American people deserve more than what they have now. They should be able to get health care when they need it, and they should not have to worry that it's available. They should be able to go to their doctor or to their pharmacy without running up their debt or being forced to choose between paying their rent or a medical bill. They should have health providers that aren't too overworked and burned out to provide them quality care. They should have primary care, mental health care, addiction care, dental care, cancer treatment, and more available to them without waiting months or traveling for hours or being left to hope for an available clinical trial. Americans should have unquestioned health care access and quality, and I want to deliver on that for every single American. But Robert F. Kennedy Jr. will only make this harder by embracing Donald Trump, Elon Musk, and the spread of vaccine disinformation. I'm not alone in my concern. I've received over 1,000 calls and emails to my office opposing his nomination. I have also received letters from over 20,000 physicians, including thousands of pediatricians, internal medicine, emergency medicine, doctors representing all 50 states and Puerto Rico, over 800 public health officials, 75 Nobel laureates oppose his confirmation, chairs of pediatric departments across the country, and statements from the Massachusetts Teachers Association representing over 11,000 educators, and from the National Nurses Union representing 225,000 nurses, all opposing Robert F. Kennedy Jr. Every single one of them expressed concern and dismay about having a Secretary of Health and Human Service that doesn't believe in vaccines that save lives. We need to listen to the people on the front lines, the health providers, who have dedicated their lives to serving their patients, the researchers who have committed to finding life-saving treatments and cures, and the educators who care for our nation's children each and every day. They are all saying no to Robert F. Kennedy Jr. He is unqualified, and his confirmation would be dangerous to the health of our nation. And with that, Mr. President, I yield back.